So I've got a question here from someone and they said, I've started cooking my foods, having bone broth and royal jelly. I feel better, but my skin is breaking out like crazy. Could this be related? What I wanted to do was answer this question in a video because I want to use this to explain the idea in Chinese medicine of tonification, harmonization or harmonizing, purgation, right? These are three different herbal medicine methods, which essentially you're trying to replicate with foods, particularly tonification. Hi, Marie Hopkinson. Welcome back to the Chinese Medicine Podcast, the place where you can come to have acupuncture and Chinese herbal medicine and Chinese medicine theory easily and quickly explained to you. Well, sometimes quickly, sometimes in a long-winded way, but it's for people who are interested in learning about Chinese medicine and how does it work. I've had 20 years of experience in practicing Chinese medicine and more than 10 years as a teacher of Chinese medicine. And I really just love helping people. So we've been doing a lot of live streams lately, which has been great. And so if you're interested in asking a question, you can put the questions on the link in the thingy below this video. You can also put the questions on the live stream, so you can look out for when those are. They're just at impromptu times at the moment. But I'm trying to do that. So I've got a question here from someone and they said, I've started cooking my foods, having bone broth and royal jelly. I feel better, but my skin is breaking out like crazy. Could this be related? And this was a question that happened on the live stream, but it was after the stream had finished. So what can happen? And this is what I wanted to do was answer this question in a video because I want to use this as a way to explain the idea in Chinese medicine of tonification, harmonization or harmonizing, purgation, right? These are three different herbal medicine methods, which essentially you're trying to replicate with foods, particularly tonification. So come with me on a little journey here because it needs a little bit of an explanation to explain these different things. Sometimes in Chinese herbal medicine, we might see, or even with acupuncture, let's say, a patient needs tonification, but at the same time, they also have stagnation or congestion there. Now, how will we know this? Mostly by their pulse. So if their pulse indicates that they're deficient and they need that tonification, and there's no signs in their pulse that they have stagnation or like congestion, let's say, or they have any stuckness going on there, and it also relates to their symptoms as well. Then, as a herbalist, particularly in a classical system of Chinese medicine, I'll just jump straight into that tonification method. That's a very broad thing. There can be lots of different herbal methods that are used. So like you might have a blood tonification method or qi tonification methods or yang tonification methods. But essentially it's all a very similar idea of, okay, we're going to put substance into your body or basically be encouraging your body to boost up its resource. And when you're doing that, you're certainly the opposite of that would be purging. Purging is like an opening method and literally is that. So one purging method is used with vomiting. It's not very commonly used, but I have seen it used in Chinese medicine hospitals. Purging method is mostly often used downwardly, so like opening the bowels or increasing urination or something like that. Now that's an extreme method that's used when you have like an extreme situation or a very acute situation. So you might have toxicity in your body from, something occurring. Now, kind of in between those methods is the harmonization method. So let's say purgation method, we can think of that at that direction of things going down. Now, harmonization is kind of this way, right? And ensuring that there's a smooth flow and ensuring that there's no congestion. So if you think of it on a TCM level, they'd say like smoothing the flow of liver qi or reducing liver qi stagnation. Liver qi stagnation would be the diagnosis. In a classical Chinese medicine sense, we still think of it as the wood element, but it's more like just the qi of the wood or the energy of wood. And it's also within the Sanjiao usually, which is your triple warmer kind of in this area. And what can commonly happen is a patient is deficient, like they need tonification, they need that building up, but they also have stagnation at the same time. And this is where formulas like Xiao Yao San kind of came around. Xiao Yao San is like a formula that's designed to tonify blood and move stagnant qi. So it's kind of using the roots of Shao Chai Hu Tang, which is purely a harmonizing formula. And then you've got these blood tonic herbs like Deng Gui in there and stuff like that kind of tonify blood, but you've also got this moving blood aspect in there as well. Like that's how TCM kind of looks at it. And lots of patients feel good on that formula, but when they stop taking it, it kind of like, well, everything just kind of comes back, right? Because they're kind of doing these two things at once. Recently, someone asked me on the channel, what's the difference between classical Chinese medicine and traditional Chinese medicine? I forgot to mention this really big difference. One difference is in classical Chinese medicine, we always do this one step at a time thing. So we wouldn't be harmonizing you and tonifying you. We'll either be doing tonifying or harmonizing. So you're taking a formula that kind of does one specific, like it's one message at a time to the body. It's a much slower approach, but it's very systematic. Now you could be on a tonifying formula and then you need to harmonize for a little bit and then you go back to the tonifying, and that's very common at some points in the treatment. But in general, like you would never be taking those two at once. You wouldn't be like, oh, here's some harmonizing in the morning and some tonifying at night, or mixing the two together. But that's what Xiao Yao San does. And that was kind of the evolution of Chinese medicine. They were kind of thinking, oh, we could just do these things together. Now, sometimes in cases like you might have a patient that has a need for tonification, but every time you tonify them, they have a flare up. And that's probably what's happening here with the foods, right, in your situation. Now, just to remind people, I don't give out individual health advice on this channel. If you are not sure about what to do, you need to see your own Chinese herbal medicine practitioner or own acupuncture practitioner. But this is just a general guide, and it's more to explain what your herbalist or what your acupuncturist is already doing, right? So I'm assuming people watching this channel already have a practitioner. And that you, if you don't have one, that you are using this as a way to kind of look at having a practitioner, because YouTube's not a replacement for medicine. It's not a replacement for a doctor. Anyway, that's out of the way now, because lots of the time there's new people watching this. So when you're tonifying something, you're building up this substance, and the process of building that up can then cause congestion. So let's say this person said they started cooking their foods, having bone broth and royal jelly, they feel better. So yeah, okay, on one hand your body's saying, yeah, I love this stuff, it's really good. But on the other hand, it's quite rich. So because it's a food substance, there's a couple of options, a few things you could do. You could simply just reduce the dose of it down. Like you might be having a lot, I don't know how much you're doing. Sometimes people say, oh, this is really healthy, I'm gonna have a lot of it. So you could just have it less, whatever you're using, just halve it, right? So have half the dose, or take it, half as often or something like that. You could stop taking it and use kind of a very, it's hard to replicate harmonizing method with foods. You just need to get a harmonizing formula from a practitioner, or talk to your TCM practitioner, and so you would want to, like, maybe they've got you on a harmonizing formula or some kind of purging formula or something like that. If you're seeing a TCM practitioner, they might not fully understand what we're talking about here. It really needs to be a classical Chinese herbalist to kind of understand this fully, of how to use this, because some people just think of, in TCM, some people just think of Shao Chai Hu Tong, for instance, as a cold and flu type of formula, not used as generically as like a Xiao Yao San, as they would use that, right? But essentially, it's the qi moving part of the Xiao Yao San formula. That's what Shao Chai Hu Tong is. Now, that's the representative formula of harmonizing formulas, but it's not the only formula. There's lots of sorts of harmonizing formulas in there. So essentially, you want to kind of get that qi moving. So you could reduce the pressure on your digestive system, because these foods that are tonifying tend to be harder to digest, right? Sometimes they take more time to digest it. And if there's any kind of blockage there, so if your bowels were blocked, then you would want to make sure that that's moving smoothly before you start doing all this. What sometimes is happening is that tonification effect of the herbs, as it builds up the congestion, it's actually causing a little bit of heat, and that heat is flushing up to the surface, and that's why you're saying your skin's breaking out. It's not heat as in external heat, so you don't need to go and take like a yin chow san or something really purging like that, or really cooling. Simply stopping those foods might help. You want to think about, with the bone broth, where does it come from? If you're making it yourself, that's different to if you're buying it over the counter. There might be some preservatives or something in that you haven't been used to having, that is reacting with you, or something like that as well. So that's possibilities. And also the royal jelly, like, where's it coming from? It's hard to know with those Chinese brands. So maybe just go for the bone broth instead of the royal jelly or something like that. that might help you. Generally this is how we would approach it with a herbs method. You could kind of do it similarly with the foods. If you take tonifying herbs and your body's got any kind of congestion, then it kind of that reacts with it, and that's when you feel worse or you don't feel good. And then if that kind of reacts more and creates that congestion makes your yang flare out, which is the heat symptoms that you're seeing, then that's the skin breaking out. That's because of the congestion of it. The other possibility to think about is you're thinking about one or two foods. They're not necessarily how your body reacts to those one or two foods in isolation, but how does it react to that food in the context of the other stuff that you're having. So if your overall diet is really heavy and rich and dense, or overly dampening, let's say, I would assume it's probably not, but let's say it is, then you have these other heavier rich foods, and then it's even harder to digest. So and lots of dairy, rich, creamy, sugar, if you're craving sugars and things like that. A lot of what Chinese diet therapy isn't sort of like, oh, here's this one weird food or this one trick food to help you. It's the context of everything you're having. You know, I see lots of people comment on these videos sometimes from time to time saying, why didn't you just tell us the one food that could fix this? Or why didn't you tell me the 3 foods that could solve my problem? Because it's not 3 foods that can solve your problem. People who are saying that are lying to you, and people want to know. Like even I want to know if I knew what one food I could take and lose weight, or one supplement I could take, and my brain would work faster or better. Everyone would be doing it, but those things don't exist. I'm not saying there aren't things that do those things, but it's not that one thing in isolation. You have to work on the base level of what's happening first. And if you can work on by eliminating stuff rather than just adding this one thing in. So I have no idea what your situation is, and that's fine. I don't expect people to give their life story, especially on YouTube. But this is the kinds of things we would be thinking about as a practitioner. So the reason why I make this channel is so if you're watching this, you're thinking, what kind of value would I get out of seeing a practitioner? This is what we're thinking about. It's not just like, oh, here's 5 foods for dampness or 5 foods to tonify blood or something like that. This is sometimes foods might not be prescribed to patients that I see because of their overall context of their diet, and also their ability to, make those things or get those things, might be compromised. So I wouldn't be getting bone broth over the counter, from the cold, you don't know what supermarkets you have where you are, but the supermarket ones that are in a container versus making it yourself. If you couldn't make it yourself, well then let's just go for something else, make other blood tonic foods. So if you want to tonify blood and you're finding these 2 foods very, very rich and they're making you break out, and you're not able to get to a herbalist or do those harmonizing formulas or something like that in the meantime, or taking a break from it doesn't help you, then you could just try the plant-based ones. So things like purple carrot, all your root vegetables generally help your spleen and your earth element as well, but things that are purple or dark coloured, beetroot, that kind of stuff, purple cabbage even, that sort of stuff can help tonify blood from that level. I've made a video about that stuff as well. But thanks so much for your question. I hope this has helped you, and also I want to use this as an opportunity just to explain those kinds of methods. So you've got tonification method, holding things in, and you've got a purgation method, which is really letting everything out in a way. And Chinese herbal formulas kind of have variations of that. Like you can have very strongly purging, you can have very mildly purging. And then you have harmonizing formulas. And there's some harmonizing formulas that kind of have a purgation effect as well. Like they have a mild opening the digestive tract much more than the other harmonizing kind of formulas. So there's different spectrums with that, and yet that's what a herbalist goes to school for all this time, to kind of work all that stuff out. So thank you so much for your question. If you've got a question, pop it in the comments below and I'll try to answer it. There'll be some more live streams coming up. Make sure you subscribe to the channel if you haven't already. We're trying to get to 5,000 subscribers this year. I'd love to see that. We're nearly there, actually. It's really great. I've seen so many people subscribing. So thank you so much for your support, and I'll see you again on the next video soon.